tamamdır. Çok teşekkür ediyorum.
Well, thank you. As I say, today we'll look into the individual variabilities of addictive substances. As an introduction to this, of course, firstly, we need to confirm effective concentrations. What is therapeutic drug monitorization? Because conceptually, drug monitorization is quite critical in following the substances that would lead to addiction. Well, if you want to follow a drug monitorization, especially we need to take a look at the effective concentrations or to investigate the unexpected lack of efficacy, to check compliance, to avoid or anticipate toxic concentrations. There are many other purposes of TDM, of course. Follow the use of substances, considering the distribution of these substances in terms of absorption, metabolites. There are different factors to be considered in biological fluids substance levels. After single dose analysis, we understand that Tmax are the important. Under the curve areas are the pharmacokinetic factors, but in multiple uses, firstly, CSS is the actually in terms of reaching this concentration. It's important. Therefore, as a part of the drugs that are used for therapeutic purposes, in those who have a narrow therapeutic index, I think it's extremely important, but sometimes we see, as I will show you in a minute, with examples, in especially in some drugs of absolute doses, there might be different pharmacokinetic distributions, as a result of which potential effects might vary. Therefore, when do we need to use TDM? If we expect any pharmacokinetic variability or the concentration-related therapeutic and adverse effects are also important in concentration, or the therapeutic index is narrow, or sometimes when there is a saturation kinetics, when there are individual differences, of course, in toxicity, or in cyclosporin-like drugs where we have difficulty in identifying toxicity, we need TDI. Actually, when monitoring these drugs, we perform TDM according to these conditions, but sometimes in some of these substances we use them for therapeutic purposes, and they might need to be included in drug monitoring as well. There are quite different aspects in biological fluids like blood, saliva, tear, or sweat. But many antipsychotics that are being used would be important in terms of TDM, where there might be some addiction potentials present. And these addiction potentials may vary according to the individual. So as to be monitoring these, there are important mechanisms such as clinical pharmaceutical practices or the side effect monitorization are quite important in terms of the prescription pharmacotherapeutic ways. But what really matters here is to have a good and accurate detection of the levels. And I'm just skipping through the slides due to time constraints. Of course, in here we are speaking about the findings of National Institute on Alcohol Abuse and Alcoholism. In their page, there are some genetic markers that are indicated for TDM as well. In particular, first and second generation antipsychotics, mood stabilizers such as lithium valproic acid and carbamazepine-like drugs, or antidepressants. It's particularly recommended to follow the therapeutic doses so that the addiction potentials would be kept under control. Some of them are those presenting with narrow therapeutic index, but some do not have a narrow index but may vary individually during the treatment, therefore would require monitorization. Particularly in neuropsychopharmacology, monitoring the level of drug is recommended because of many reasons, but basically we are speaking about an effective treatment and determination and avoidance of addiction potential, and of course individual specific factors such as ethnic differences, individual differences, or differences of individual metabolization of the drugs, or sometimes the patient's personal diseases, supplements, or any OTCs or other drugs or potential products being used by the individual. Well, as Dr. Yalçın referred to, as a list of the addictive drugs, why they would cause addictions, which was a very good and thorough summary. But as you can see, there are many different substances and factors leading to addiction. And for each of them, there are different guidelines defined in the AHD. And maybe it's for some of the rest, when looking into the detection of addiction, it is important to look into a metabolization of these drugs in individuals. And during the analysis, individual differences might also play a role because at the end of the day, if we want to look into a biological fluid by measuring the levels for presence of addiction, but pharmacokinetic parameters are affecting these levels, also genetic features of the individual may also have an impact on the pharmacokinetics of these substances. Therefore, the timing of biological sampling is also important. Second, fourth, sixth, 8-hour sampling may not be possible for everyone. Why? Because individually there can be pharmacokinetic differences in terms of the metabolization of individuals. Pharmacokinetically, the removal time from the body may be different. Therefore, when following the levels there as a part of the analysis methods, timing is also an important aspect for addiction as well.
Sınıflandırıyoruz. Aslında bu genel sınıflandırma
Where to classify? Drug Enforcement Administration, DEA, makes a drug scheduling. According to this classification, Schedule 1 drugs or substances are the ones that are defined as drugs with no currently accepted medical use and a high potential for abuse. These are the ones that would include heroines or LSDs or ecstasy. The second schedule is about the drug substances and chemicals that would have a high potential for abuse, but would, in some instances, are recommended or required to be used, considering the potential benefits, such as cocaine or oxycodone or methadone or Ritalin. These are the drugs that are included in Schedule 2 with second level of addiction potential. Whether or not they would lead to addiction would depend on the metabolism speed of the individuals, as well as the stable presence of these drugs in the blood. Schedule 3 are the ones that wouldn't have a high potential of addiction, like ketamine or testosterone or anabolic steroids are included in this group, which are the third schedule of drugs. Schedule 4 is related to Xanax, Valium, or the other types, and 5 is about the cough preparations with less than 200 milligrams of codeine, such as analgesics also, and Lumotil. When you check into the list of DAA, Alphabetic listing of controlled substances are also available. According to this listing, we understand whether or not they are prescribable, whether or not they are banned or not. For cannabis and marijuana, although today cannabis containing or CBD containing or THC is a prohibited substance, but in terms of CBT, we see that because of THC and its metabolites, it's class 1, as you can see. To my left, to your right, stage 1, according to DEA classification.
Da sınıflandırmış durumda. Bunların tabii sınıflarına tek tek ulaşabiliyorsunuz. Mesela gamma
You can find these classifications. Heroin class 1. Cocaine is class 2. Amphetamine, methylphenidate, also class 2, schedule 2. Actually, they would present with a high addiction potential, and as a matter of fact, their use as a drug is also possible. And beyond that, maybe there are some aspects to be considered in their abuse, both in terms of the drug levels, where you will find an access to the list on the National Institute of Drug Abuse. For each of them, misuse of prescription is also provided. This is about all the factors that can be the case when there is an abuse of these substances. We should pay attention to especially Schedule 2, 3, and 4 substances, according to DEA, barbiturates, benzodiazepines, or sleep medications, zaleplon, zolpidem, like drugs, are indeed important to be followed in terms of dosing. Some inhalants also may also cause some kind of addiction, such as aminitrate, for instance, is not provided in the schedule. For ketamine, Schedule 3 is being used quite frequently because it has a high potential, especially codeine, fentanyl, hydrocodone, hydromorphone, pyridyl, methadone, morphine, oxycodone, oxymorphone are also the drugs that are included in Schedule 2, according to DEA listing, which shows an addiction potential of these drugs. So we may find individual differences, particularly in terms of the biological level of presence in liquids, because they may also have a potential there. Steroids, methamphetamine, and these kind of drugs are given as a part of the listing. And the thing that I'm trying to do, giving you all the lists, is normally the substances that we use in routine practice may lead to addiction and higher probability because of the individual differences. Therefore, we need to look into the individual differences of addiction potentials of these substances as a part of our monitorization. Therefore, biological fluid presence may be predicted. This is important in having a proper and accurate dosing of these concentrations. Whenever we reach a dangerous potential, we should be making a proper timing. Particularly in multiple uses, we should be alert. Once it has not reached a stable concentration, we should try to avoid making a conclusion. There are two dimensions of this. Number one is when using these substances with high addiction potential as a part of our medical treatment, we should be able to monitorize the effective doses and their potential of addiction. Therefore, the stable concentration must be tested in biological fluids and the proper timings. This is an important parameter. What does it depend on? It depends on the genetic polymorphism of individuals because pharmacokinetic factors are quite associated with genetic polymorphisms. There are many, of course, references that will show the genetic polymorphisms.
Metabolizmasından sorumlu olan sindromların
Uh,
özellikleri nedir? Evet,
you will find in major the liver that is involving the metabolites, but there is a huge distribution. Almost all organs will have a different type of these midbrain cerebellum, pituitary glands, dorsal root ganglia even, would have different cytochrome P enzymes, showing that metabolism is not taking place only in the liver.
ilaçlar için metabolizmanın devam
And
ettiği
metabolism may persist in different organs as well. Therefore, particularly in the central nervous system, in the drugs that would have an effect on the CNS, the enzymes will have genetic polymorphism effect. Therefore, the level of drugs in the organs may be totally effective.
spiral kafein klozapin teorifenin içerisinde bir C olduğunu
CYP1,
gene burada
CYP2, C9, CYP2C, 19, CYP2D6, CYP3A4, CYP3A5 are the genetic polymorphisms that we need to look into. Can you please wrap up? Phenobarbital, some of these, and some inducers even, together with the vectors that can be drug-to-drug interactions where the concentrations may be affected, therefore are important.
Dolayısıyla bu ilaçların bu durum nerede önemli oluyor bizim için?
Why is this important? It is important because if the genetic polymorphism is responsible for this mechanism, or if at the time there is an inducing or inhibiting use of another drug, this also would play a key role in the treatment of addiction as well, because the methods that you're using for addiction may also be affected, including the treatment success.
Değiştirebilirler. Buna mutlaka dikkate almamız gerekiyor. Son 3-4 slaytım zaten.
Just a couple of more slides to go.
Neler var?
CYP2D6, CYP2A6, CYP2C19, CYP2E1 are the members of the CYP superfamily of the heme-based oxidases that are genetically variable and can metabolically detoxify or activate numerous types of drugs, including drugs of abuse. Therefore, differences in pattern of drug metabolism among individuals and across ethnic groups due to genetic variable CYP isomes are likely to importantly affect the risk of drug dependence. The effects of genetically variable metabolism of drugs of abuse depends on whether the parent drug, metabolite or metabolites or both are responsible. Another thing is CYP2A6 is the enzyme that is responsible for the majority of metabolic inactivation of nicotine, the tobacco smoking, whereas the preliminary analysis of CYP2C19 and CYP2E1 polymorphisms provide evidence that this is quite viable in terms of individual differences. Therefore, it is important to identify when a person have abused these addictive substances, especially when or if these results are important in criminal events. When making the biological fluid measurements, we need to take into absorption, distribution, metabolism as well. Okay, this is a general conclusion, and I can finish off with this general slide with this very nice caricature.
Özelliğimiz var ki bunlar bağımlılık da dahil olmak üzere ne yapıyor? Bizim bütün aslında ilaçlara cevabımızı değiştirebiliyor. Hepinize
Thank you.